Bismillahirrahmanirrahim. Hi everyone. This is Professor Dr. Mohammad Irfan, Dean, Faculty of Pharmaceutical Sciences, Government College University, Faisalabad. Firstly, I would like to pass on my sincere gratitude to Dr. Ghulam Hussain, Chairperson Department of Physiology, and Dr. Ikramullah Khan, Chairperson Department of Pharmaceutic, and their teams for arranging such an wonderful conference. I'm also grateful to all international and national speaker presenters and attendees who have joined to attend this conference. I wish I could have presented this work physically, but due to some urgent meeting in Lahore scheduled on the same dates, I could not do that. Therefore, I'm sending my talk through recording. My today's talk title is Advanced Drug Delivery System for Brain Tumor Targeting. Here is the quick outline of my today's talk. I will present the short introduction about brain tumor, followed by the different challenges in developing different drug delivery systems for brain targeting. Then I will present a brief structure of blood-brain barrier, followed by different transport routes of drug molecules which are needed for crossing the blood-brain barrier. And next, I will present different strategies which are used for regulating and crossing the blood-brain barrier. And importantly, I will present the different engineer brain targeted delivery systems which are recently being investigated and are being used for targeting the brain tumors. And at the end, I will present the conclusion and the future prospect of my talk. So first to the introduction. Brain tumor accounts about 1.6% of incidence and 2.5% of mortality of all tumors as per WHO data in 2025. Among them, glioma, this is the most invasive type of brain tumor which have a high recurrence rate and poor patient prognosis that accounts for 30% of all brain tumors. And regarding treatment, surgery is considered as a treatment of choice, but its invasiveness and fuzzy boundary that really make it difficult to completely eradicate and remove tumor, and that can have a recurrence rate which is more than 90%. And therefore, chemotherapy in combination with radiotherapy have always become a standard therapy for post-operative brain tumors. There are different classes of the drugs available for treating different peripheral tumors, and that includes nitrosourea, anthracycline, topoisomerase inhibitor, integrin receptor inhibitor, EGFR inhibitors, deacetylase inhibitors. But their specificity have become really questionable, very compromised when they are being used for the treatment of the brain tumor due to their low efficacy and severe side effect. Therefore, there is still urgent need to develop targeted drug delivery systems which have high efficiency and low toxicity for treating brain tumors. We have the different challenges which are out there in developing drug delivery systems for brain targeting. On the one hand, if we talk about the physiological barriers such as blood-brain barrier, blood-brain tumor barrier, and overexpressed flux of the pumps that basically prevents the entry of the drugs into the central nervous systems and then reaching the tumor site. On the other side, we experience also the inherent characteristics of the brain tumor infiltration, invasion, high heterogeneity, and the drug resistance, which is caused by the microtumor environment. They can further hamper the entry of the therapeutic agents to reach the tumor site in the CNS. And therefore, we have a high recurrence rate. And if we talk about the median survival rate, which is only 20 months among 20 months for all patients suffering from brain tumor. In order to really develop brain targeted delivery systems, we need to understand the structure of the blood brain barrier. Basically, it consists of endothelial cells, which are considered as the blood brain barrier's anatomical structures, which is the core structure present inside. And outside, there is a presence of the tight junctions, which basically control the permeability of the blood brain barrier. and they are surrounded by the pericytes, which are all the mural cells, and then outside we have the astrocytes. They are also known as the numerous glial cells, which are heterogeneously present throughout the brain. In order to treat different diseases of brain, CNS, that includes brain tumor, Alzheimer disease, Parkinson's disease, and other neurodegenerative disorders. The drugs has to cross the blood-brain barrier and reach to the target sites. So there are different routes of the available through which the drug molecule can cross the blood-brain barrier. For example, we have the transported mediated transcytosis. We have also cell mediated transcytosis. We have also lipophilic pathway. We have also efflux pumps, which basically help out in passing the drugs from blood-brain barrier and reaching the target site. We have also different non-invasive strategies which are basically used in comparison to the invasive strategies for reaching our or for developing the systems for reaching the drugs to the target site in the CNS. The first one is the intranasal administration. This is also one of the non-invasive route which basically allow quick rapid targeting from nose to the brain, and then thus bypassing the invasive intraventricular and intraperitoneal injection route. In addition, we have also ligand conjugation, that is also known as a ligand functionalization, which is a very active target strategies using ligand that helps to reach to the receptors in the CNS, where the drug can reach and then can basically express its therapeutic effect. Uh, Recently, we have also some strategy. We have also one strategy that is known as the membrane coating. So, where the different coatings are the membranes are being done, and thanks to the multiple molecular interactions such as the hydrogen bonding, electrostatic interactions, and the pi interactions between the membrane and the potential substrates, that helps to take the substrate into the CNS and then express its therapeutic effect. And lastly, we have also some blood-brain disruption by the external stimuli, such as with the use of the light, ultrasound, and magnetic field, we can disrupt the blood-brain barrier and can help the drug to reach to the target site. Next, in order to treat this brain tumor or the CNS disorder, various types of the engineer brain targeted therapy systems are out there. That includes liposomes. Their particle size ranges from 50 to 500. Then we have polymeric nanoparticles. Their size ranges less than 200. Then we have a gold nanoparticles. They are also from 2 to 18 nanometer. Then we have carbon nanotubes, followed by then the iron oxide nanoparticle. At the end, we have some customized biomimetic systems which are also used for the delivery of the anti-neoplastic agent to treat the brain tumor. Now we can go through the formulation strategies. The first one is the liposomal formulations. Liposomes, they are considered as a first generation of the drug delivery that has been widely used since they are invented. They are simply consist of one or more lipid bilayer, and inside they have the aqueous compartment, which help us to load more drug. And also both hydrophilic and the lipophilic drug can be loaded on the liposomal formulation. They have a good biocompatibility. They are biodegradable. There is no need to remove from the body once they are administered. And also further, their brain targeting delivery can be more focus, can be enhanced by doing the modification of the targeting ligands, including polymers, peptides, antibodies, and aptamers. Next, we have the polymeric drug delivery systems. They have also shown a very good potential in the preclinical studies, and they can basically release the drug bolts in a controlled way, and also the drug can be taken up by the cells. In this regard, mostly PLCA based drug systems they are in use and they have been widely explored. PLCA is a biodegradable polymer and have the ability to encapsulate the small molecules including both drugs, genes, proteins, vaccines, and they have high bioavailability. And also we have an advantage associated with the PLCA that there is no need to removal of after the administration of, because they are the biodegradable polymer. Next is we have also some amphiphilic polymer micelles. They have size range between 2 to 300 nanometer that enable high drug loading and prolong blood circulation. And the good thing is that the amphiphilic molecule has both hydrophilic head and hydrophobic tail, and it has the ability to encapsulate both hydrophilic and hydrophobic drug. Further, we have also available gold nanomaterials. People they are still working on the gold nanomaterials. They have a good distinct advantages over other conventional delivery for brain diseases. They have a unique inner surface chemistry that allows limited interaction with the nanobio interface, and consequently, it leads to the high cellular and tissue compatibility. They are also very simple to synthesize. The drugs can be absorbed, can be loaded onto the surface via gold thiol bonding. And so currently, some gold nanomaterial based systems they are currently underway and they are at the preclinical and clinical trial stages. But still, we need to explore more their limitation and strengths to have a more idea about their compatibility. Next, the carbon and carbon materials that includes carbon darts, carbon nanotubes, graphene oxide. They have been also considered as a promising agent for biomedical applications. Especially among them, the carbon darts have been exploited as a biocompatible nanocarriers due to their tunable properties and a good photo stability and have a smaller size. Below you can see the structure of carbon nanotubes which represent that inside the drug is loaded and outside there is a hollow structure of the carbon nanotubes. Further, we have the iron oxide nanoparticles. They are also class of the widely used nanomaterials for biomedical applications, including drug delivery, bioimaging, hyperthermia therapy, and magnetic separations. And these iron oxide nanoparticle with the different size, shapes, and morphology could be synthesized in a controlled way. And also, they have the advantage of that the delivery through the iron oxide nanoparticles can be trackable, can be tracked through image guided therapy. Next class is that includes the silica nanomaterials. Mesoporous silica nanoparticle have a special characteristics. They have ordered pore size. Their size ranges from 2 to 50 nanometer. They have a higher volume that basically results in a high surface area, and resultantly we can load a higher amount of the drug onto the mesoporous silica, and simply we can load our drug on the mesoporous silica through absorption. And they have shown a good permeability across the blood brain barrier, and then they can release the drug at the target tumor site. Lastly, we have some also biomimetic drug delivery systems. They are the customized drug delivery systems which can be programmed according to the qualities or the physicochemical properties of our engineered material. The mostly that include biomacromolecule enabled strategy, exosomes mediated carrier, virus inspired synthesis, extracellular vesicles, and then bacteria bionic strategies. They have also been adopted in the preparation of the custom built nanocarriers. In addition to the aforementioned strategies and materials, we have some also other materials available, which is biotechnologically produced and still can be considered as a good carrier for crossing the blood-brain barrier. That includes two-dimensional black phosphorus. It has a capacity to load high drug loading, and it's also stable and biocompatible. And researchers they are working on it, and in future more aspects of the black phosphorus for the delivery of the brain can be investigated. So, lastly, to the conclusion, the intact blood-brain barrier consisted of endothelial cells and tight junctions impede brain permeability of therapeutic agents, which largely compromise their therapeutic efficacy and ultimately compromise the treatment of the CNS diseases. However, various engineered delivery systems with appropriate physicochemical properties, multifunctional modules, and good biocompatibility that can guarantee excellent performance of the blood-brain barrier penetration for enhanced drug delivery. If we talk about the future prospects, although extensive achievement have been made in this community with several FDA approved trials, there is still a long way to go from the clinical popularizations and translational application. In addition to the drug delivery, a combinational delivery of the other agents such as imaging probes and biosensors is anticipated to improve therapeutic efficacy by fabricating the theranostic nanoplatform. Also, there is a need to further continuous interdisciplinary cooperation will that can build a broader platform for enhanced blood-brain crossing for treatment of the brain disease in future. Thank you. Thank you very much for being patient.